Either or anyway, it'll be wonderful. So welcome to this edition of the Native News Update on this Monday, November 23rd. I'm your host for today's program, Paul Demain. Many of the stories read here can also be found at our website at IndianCountryNews.com. Here are the news stories for the day from the Associated Press and other Native American news sources. A former official with the Connecticut tribe that runs Foxwood Resort Casino has been convicted of defrauding investors. Prosecutors say a federal jury in Hartford, Connecticut, last Thursday found 50-year-old Christopher Pearson of Ledyard guilty of 8 counts of wire fraud. Authorities said Pearson, former Deputy Chief Operating Officer of the Mashantucket Pequot Tribal Nation, defrauded investors out of $280,000 that he promised to use to buy land on the island of Roatan, Honduras. Pearson said the land would be used for a resort and casino the tribe was sponsoring. Pearson used the money instead for his own use, including boats, cars, vacations, and improvements to his waterfront home in Roatan. Pearson faces up to 20 years in prison on each count when he is sentenced on February 5th. State agencies have withheld $867,000 in grants and stimulus money from a Montana tribe since auditors revealed lax accounting practices had opened the door to potential financial abuse. The Little Shell tribe of Chippewa first ran into trouble with the state in September when auditors raised questions about how the tribe was spending money on a tobacco use prevention grant worth $180,000 annually. The audit found little relationship between the program's budget and how the money was spent. Grant money appeared to be used on expenses related to tribal elections and to publish a tribal newspaper. Travel expenses topped $35,000, more than twice the budgeted amount. Separately, in a visit to the tribe's offices in Great Falls, state officials found lax accounting for economic development grants. With no way to verify how the money was spent, this year's grant of $70,000 was put on hold. Also suspended was a $617,000 federal stimulus grant that the state legislature had directed toward the tribe. The tribe has been given until today to show it has fixed its accounting procedures. Some residents of the Riverton, Wyoming area city are expressing concern about a proposed agreement between the city and the Northern Arapaho tribe to cooperate on common interest. The city and tribe have agreed to work together on issues such as zoning and land use planning and economic development efforts. They also agreed to enter into mediation on future disputes instead of going directly to the courts. The idea of these agreements is to try to develop a process by which people can work together, Riverton Mayor John Vincent said. Northern Arapaho Tribal Co-Chairman Norman Willow said the tribe was trying to develop a better, well-established concrete future for our young people. But during a public meeting last week, Fremont County resident Mike McDonald relayed fears from people he knew about being forced under the jurisdiction of the Wind River Reservation and Tribe. In our continuing quest to understand some of the potential changes and impact to Indian Health Service and health care for Native people during this national health care debate going on in D.C. across the country, we have again turned to Shoshone-Bannock tribal member Mark Treyant, who's been following the debate while reporting on the issue as a Kaiser Media Fellow.
Okay, Mark, we're on. It's not very easy to have a short, concise discussion on health care, but we're going to try that today. Tell us where we're at with this huge debate going on and how it's impacting Indian country.
Well, let me just say this. Indian country has a lot of stake in what happens in the next few days. The provisions in both the Senate and the House bill are huge, and they could greatly benefit the entire Indian healthcare system.
When you're looking, you said you've read through that document. How many pages is that?
1270, I guess.
Okay, and you said that there was several places where it impacted Indian country in terms of policy and budget.
Right. The biggest on budget is actual line item for Medicare increased payments, which would be direct money to IHS. But indirectly, and probably more important, is a much easier way to get Medicaid and children's health insurance money into the Indian health system.
And was that part of the announcement that the Secretary of Health and Social Service, Kathleen Sebelius, is that somehow connected to each other, this bill and her announcement last week?
No, Sebelius's move is entirely separate. It's on top of it.
Okay, it's on top of it. And what would that do? That would bring thousands of Native Americans into the Medicare system?
Right. One example is, and this is a example that's often cited, is a young American Indian male who's below the poverty guidelines right now would not be included at all in Medicaid. Indian Health Service would have to pick up that money. So if it's contract health care money, they'd be out. When the money's gone, they'd be gone. Now, under this bill, a single adult would qualify for Medicaid. So IHS would no longer have to pay the cost of that service.
So basically, it's just utilizing available services better within the Indian Health Service system.
But within the federal government, yes.
Within
not
the federal
just
government. And
the other part of the bill, though, that I think is just outstanding is much more increased focus on education and training and workforce development. And specifically, and I just love this, specifically, tribal colleges are in the budget, are in the bill.
And so if this bill is passed, tribal community colleges could expect some funding for the development of health staff people?
Exactly. In fact, I think if the right proposal were put together, I could see the federal government funding an American Indian Alaska Native medical school.
You have any ideas where that might end up being? As Kansas, Haskell's been kind of the center of college education in the past.
Sure.
Like that.
I would put Seattle on that list just because I'll be a homer booster for a second, because we have a facility that could be used almost immediately.
And we want to thank Mark Trahant for that report. In other news, a spiritual leader from the Fort Belknap Reservation says many tribes are losing their language and religious traditions as older members pass away. Joe Ironman spoke last week in Billings, Montana during a conference about spirituality and wellness hosted by the Montana-Wyoming Tribal Leaders Council. He says American Indians need their cultural roots for strength and identity and that elders must pass on their knowledge to younger members. Clinical psychologist Joseph Stone said American Indians face plenty of challenges, many stemming from stresses handed down after earlier generations were forcibly removed from their homeland. But he says those stresses can be soothed by reviving traditions that were lost when Indian children were sent to Christian boarding schools or when families tried to assimilate into white culture. Native American groups gathered in Prior Lake, Minnesota last week to strengthen their clout in global climate change talks. The Native Peoples Native Homelands Conference aimed to give Indigenous people more say ahead of a 192-nation conference on climate change in Copenhagen during December. The conference will look at the effect of climate change on Native American communities, touching on subjects including subsistence economies, traditional plants, and sacred sites. Organizers say global warming has a disproportionate effect on Indian communities because of their relationship to the land. Sponsors include the National Aeronautics and Space Administration, 36 tribal colleges, and Native American environmental groups. The conference ran through this weekend at Mystic Lake Casino Hotel. And that is the latest roundup of news from Indian Country on this edition of the Native News Update. We want to thank you for joining with us. Join with us again soon. Miigwech.